your forecast first. Sponsored by Matex Heating, Cooling, and Plumbing.
Hey, the sunshine came back today. Yeah, it was nice. Look at that. Beautiful. Gibson City on our roofing dugout at Gibson Area Hospital camera. Few cumulus clouds mixed in there, but overall, it's been a nice Tuesday. Enjoy it, because it's about to go downhill for the rest of the week. All right, so clouds are showing up closer to I-70 and now near Effingham, closer to Shelbyville, but you get north of I-70 and we still have our clear skies and the relatively mild temperatures. 62 in Champaign right now, but notice the cloud cover in Effingham cutting those temperatures down a little bit. Here's how the rest of this evening will shape up for us. Temperatures into the mid-40s by around 11 o'clock. Dry. The next 5 days, though, not dry. We'll talk about all the storms and the rain in the forecast when we come back. WCIA 3 News starts right now.
Now from WCIA 3 News.
When it's used, the virus can't further replication. It terminates, and that's the end of the virus.
A newly approved drug may be the key to slowing down the spread of the coronavirus. How soon it could make its way to our area. Plus, one Central Illinois University says students are going back to campus in the fall. What they say that might look like. And the pandemic could impact the benefits you're getting. What you need to know before applying for more help.
You're watching your local news leader. This is WCIA 3 News at 5.
Discharging patients from an inpatient setting is significant when you're trying to keep your hospital volumes manageable.
A new drug is helping COVID-19 patients recover faster, and now it's reached Illinois. Good evening, I'm Jennifer Roscoe. The drug is called remdesivir. The state got hundreds of cases over the weekend, but it's not available to just anyone. WCIA 3's Courtney Bunting explains.
Research shows that a new drug, remdesivir, is helping COVID-19 patients leave their hospital beds faster. The drug was originally made during the Ebola outbreak, but was never approved by the FDA. It acts as an antiviral agent, which means it literally stops the virus from replicating. Now it's received an emergency use authorization from the FDA because of the pandemic situation. That means there's approval to use the drug globally.
So why we're seeing that this feels like it's lagging a little bit has to do with it. Because we have something novel, we're finally catching up to demand. The demand wasn't there previous to this to develop the medication at a worldwide scale, and now it is.
Remdesivir hasn't made its way to this part of the state yet. Instead, the drug is heading to hospitals with more cases.
In the state of Illinois, most of the hotspots are in Cook County and the surrounding suburbs. And so in cases like that where you have highest number, then the medications tend to go to that point.
There will be more distributions of remdesivir in the coming months, but when exactly that will happen is unclear. Reporting, I'm Courtney Bunting, WCIA 3, your local news leader.
Now, more of the drug is being made, so even though there's a limited amount right now, that will change. The state is releasing new COVID-19 case numbers today. 4,000 more people have tested positive in the last 24 hours. 144 have died. That brings the state's total to more than 83,000 cases. 3,600 people have lost their lives. These are the numbers for the entire state. To see a breakdown of cases in your county, download the WCIA 3 News app. More than 20 people at Charleston Rehab and Healthcare have tested positive. Health officials say they've ramped up testing at the nursing home in hopes of controlling the spread to others in the community. WCIA 3's Jamie Mays has more.
There have been over 20 confirmed cases of coronavirus at this facility. The health department announced one person at Charleston Rehab and Healthcare who had the virus died. As of Tuesday, they had 16 more confirmed coronavirus cases in the county. That brings the total to 62. The health department would not say how many of the additional cases were linked to Charleston Rehab and Healthcare. Sarah Bush Lincoln Health System says they have been working with the facility to get testing completed.
We're asked to do some COVID testing, and we conducted testing through our respiratory clinic our community drive-through clinic yesterday. And we also did do some testing there on site at Charleston Rehab.
All employees and residents at the facility were tested. Staff say they are working with local and state health officials to contain the virus and make sure that they are protecting the staff and residents who live here. In Charleston, Jamie Mays, WCIA 3, your local news leader.
Now, in addition to the 62 confirmed cases in Coles County, 22 people have recovered, 2 have died, 34 are recovering. Bradley University in Peoria says it will resume on-campus classes in the fall. The university says the final decision on what that will look like will be based on federal and local health guidelines, but it is looking at how to modify classroom setups and student housing for social distancing. The university says its plans may include hybrid learning with some classes online and some smaller classes meeting in person. Here's an update for you. We told you about a group at the U of I developing an emergency ventilator in response to the pandemic. Today, they announced a company is going to start producing them. WCIA 3's Andy Olson looks at what impact that'll have in the country and around the world.
It's been a month and a half since the Illinois Rapid Vent was announced. Now the design is one step closer to being used to save lives. It will be called Flex Vent. Engineers at the U of I and physicians at Carle Hospital are partnering with Belkin to produce it. The project was started to help hospitals who could be overrun during the pandemic. But right now, ventilator use is dropping. Using Illinois as an example, IDPH says 85% of ventilators around the state are open. Project lead Bill King says the ventilator can be used for more than that.
We've actually heard from a number of hospitals and health systems from other countries where they have a different situation with healthcare, and that a low-cost, easily used, disposable ventilator actually has a lot of utility. So we're really excited to see that this thing could have application beyond the COVID crisis.
The college says they made the designs available for free. They hope the FDA will approve them to start production in the next few weeks. In Urbana, Andy Olson, WCIA 3, your local news leader.
Now, another advantage to this ventilator is it doesn't depend on electricity. It runs on pressurized oxygen instead. Foster Family Appreciation Week doesn't stop during a crisis. Some are still getting the support they need. Plus, more people are applying for financial help right now, and that could impact the benefits you're already getting. We'll tell you how.